Conscious Crew podcast. Today we got a special guest from Polk County Health Department. We have Nola and, of course, Cindy Collins down there at the end. I'm DJ Marty McFly, and I'll let Nola go ahead and introduce herself and tell a little bit about what she does.
Hi, good morning. I was going to say good afternoon. I'm Nola Eigner-Davis. I am the Health Educator Public Information Officer for Polk County Health Department. My job is to help educate the community in various education initiatives about the health programs and services we do at Polk County Health Department.
Awesome. Cool. So you had said that you go into schools and kind of give a presentation, and tell us a little bit about that experience.
So I go into schools, I go into community organizations, I go into juvenile detentions, I work with refugees, immigrants, all about sexual health, education, and information about pregnancy as well. So it's really educating our public about sexually transmitted diseases, because in Polk County, in the state of Iowa, in the United States, they're at epidemic levels.
Wow.
So we really want to encourage individuals to really practice safe sex practices and to encourage them to get tested as well.
Okay, yeah, absolutely. How would you say that you encourage people to practice safe sex? Is that through handing out protection?
Yeah, so we do it through a whole bunch of different avenues. So we have condoms available at Polk County Health Department. Individuals can come get condoms, no questions asked. Obviously, that's what we want to make sure. There's also a website through Iowa Department of Public Health, My IA Free Condom. People can just plug in the website and condoms can be sent to their house.
Wow.
In discreet packaging. So that's pretty cool.
That's really amazing.
Another thing that we really do is we promote our testing services in Polk County. So at Polk County Health Department, we have confidential low-cost STD testing. So an individual can call and make an appointment. We normally can see them same day of, and they can get tested for sexually transmitted diseases at $10. And if
Did you say you'll come to them?
No, we won't come to them. They can come to us.
Oh, okay, you're come to you. Okay.
They can come to us.
All right.
And we'll test.
So that's too convenient.
Yeah, that would be way too convenient.
It's probably part of the future having STD kits sent out to you. I've seen some inside Walgreens.
Yeah,
possibly.
I've seen some, but it's a lot better for them to come to us, because then we can have that conversation with them about if they're having any symptoms, what types of sex they engage in. Because I think it's so important for people to talk about what types of sex you engage in so we can treat you appropriately.
Right.
Because if you're not having an open and honest conversation with your healthcare provider, we can't test you appropriately.
Okay. Yeah, and sometimes it's not even an STD that people have when they see different types of symptoms. It could just be from just not being hygienic. Right?
Absolutely.
Okay.
So we can see a lot of different things as well. So it's just really good to have that open and honest conversation with your healthcare provider when you're going in to get tested. And so then we're going to test you. And then, if you test positive, we'll make sure you get treated. We'll make sure that you get the appropriate referrals. Let's say if you test positive for HIV, we're going to refer you to a specialist to make sure you're getting treatment appropriately.
Wow. Awesome. Well, we really appreciate how much you guys have helped us with our Conscious Kickback. And I know that people that have come to our event have really been thankful for the condoms and all the products that you guys have supplied us for the previous kickbacks.
Yeah.
And you guys sound like you're going to be a part of our next kickback as well on March 13th.
Yep.
So again, thank you so much for helping us out. And make sure you guys check out the Conscious Kickback March 13th. Just announced this week. Tickets are on sale. Just $7. And the ones before have been awesome. Everyone has a great time. Really positive vibes. So glad you guys are a sponsor for
Absolutely.
that.
Okay. So I have a couple more questions.
Absolutely.
So I'm curious, as a parent and just as somebody who hasn't been in school in a long time, I remember sex ed. I remember kind of a sex ed in elementary school where I was learning about the menstrual cycle and stuff like that, and just learning about the different body parts all the way up until 8th grade, which I went to school in Georgia. And I know the South can be a little different when it comes to sex ed, but we did learn about STDs. But there wasn't a lot of talk about other things, because I think they were still really preaching abstinence, which is fine, but kind of, I think most people probably agree that it's unrealistic, because we all know that teenagers and people like are going to do what they're going to do.
Mm-hmm.
So I think it's best to prepare people for all outcomes. How would you say that the sex education is taught today?
That's
per age group.
It's hard to tell. It's hard to really gauge that because every school approaches it differently.
Oh, okay, that's interesting.
So every school may have their health teacher provide it, physical education, family consumer science provide it, or they may have a resource like Polk County Health Department, Planned Parenthood of Central Iowa come in and talk about sexual health. So it's kind of up to the schools on what they feel they would like to talk their students to learn.
Okay, that's awesome. I do have another question about the curriculum that you teach. I was just wondering, when you're talking about safe sex practices, do you ever talk about consent?
Absolutely. I think consent is so incredibly important and that we teach kids as young as elementary what consent is.
I love that. I just got chills because, I have 2 sons, and I feel like I've been teaching them about consent for so long. It is such an issue.
And you start teaching them as young as elementary and talking about consent in a way of well, you need to ask your friend if you want to give them a hug. You need to ask your friend if you want to high five them. So they can start building up that when you ask to do things, it's a very positive experience. Because when we're doing this with boundaries, when we're doing that, we're creating an environment that consent is always a part of a relationship because it needs to always be a part of a relationship. And I think you do that every stage of their life. So you talk about consent in elementary, such as maybe hugging, high-fiving. Middle school, now we start kind of talking a little bit about actual relationships, like maybe holding hands, maybe kissing, or we really go into the whole consent about sexual consent. And then in high school, we do the same thing. And it's always good to just refresh it, bring it up into their minds because consent is so vital to a healthy and positive relationship.
Yeah. And do you ever talk, sorry, this is kind of an add-on question with that. Do you ever talk about consent while drinking alcohol? Because I've kind of told my sons that when you get to the drinking age, I would just say drunk is a no.
Right.
If you're drinking with a girl someday and she seems inebriated and that's a no. The biggest, don't even go there.
Yep, the biggest thing that we always say is if an individual is not of sound mind, they're under the influence of drugs or alcohol, they may have a mental or physical disability where they cannot agree to it, that is automatically a no. Yeah. You have to have them able to say yes. Consent is yes. Consent is yes for everything. If they cannot consent and say yes, it is no.
Exactly. Okay. That is awesome that you, I feel just good about that being taught to kids today now starting young. So hopefully by the time they're adults, it'll be part of their mindset.
And whenever there is an individual who is in a leadership role in that child's life, so maybe it's a coach, maybe it's a teacher, maybe it's a counselor, it's really good to keep encouraging them to have conversations about consent. Because in our world, we can never hear about consent enough. Yeah. That's the way I very much look at it, is consent is always something that always has to be discussed.
And that's even with, I like how you were teaching it to elementary students about starting with hugs, because I think a lot of us, and I've read a lot of articles on this, especially before the holidays, where parents will force their daughter to give somebody a hug, to even thank them for a gift, and they might think that cousin is kind of, they don't feel comfortable around that cousin or that uncle, and they don't want to give them a hug, and the parent will be like, don't you love Uncle Ron? Go give him a hug. But the girl's like, I don't want anything to do with Uncle Ron. So you're not supposed to force your children to give hugs, Correct. You're teaching them boundaries and consent.
And that's the biggest thing with consent is boundaries and having healthy boundaries in any form of a relationship.
That's very true. I agree. I'm glad we're talking about this. This is, especially with the kids too, not forcing people to, engage with people that they don't feel comfortable. I mean,
it's incredibly important.
It's not a requirement for anyone, So just because you're dating or just because you're this or that doesn't mean.
Yep. No matter how long you've been in a relationship, you always have to have consent.
All right. I agree. All right. Awesome. So
you do not owe your body to anybody for any reason.
Correct. 100%.
Facts. Okay. So one thing I wanted to bring up is, say, when I was first started getting not drug tested, getting STD tested.
Yes, absolutely.
So it's changed.
It absolutely
and
changed.
I'm happy about that because they used to put the swab for men.
Yeah.
No, that wasn't pleasant. It made me not even want to get tested.
Yeah, it has to be painful.
But now it's so much easier because it is like a drug test now.
Right.
That's where I was going with this.
Yeah.
Is that now you just kind of pee in a cup and they just do what they do and they tell you.
So what we're going to do now is our STD testing has come immensely. The testing is just so advanced. So for chlamydia and gonorrhea, we're going to do a urine test if you're not showing symptoms. Now, if you're showing symptoms, this is where we may have to do the swab. So the swab still may come into play. So chlamydia and gonorrhea is a urine test. Syphilis, HIV, and hepatitis C are blood tests. And the cool thing about syphilis, HIV, and hepatitis C is it's a rapid test. Within about 30 minutes.
That's good. It used to be like a week.
That's nerve-wracking.
Or was that the gonorrhea one?
So a lot of
it used to be a while. I remembered when it changed because I remember just looking back and remembering that we had to wait a week and then you would find out, which I've always gotten tested every 6 months. So
yeah, that's a really great practice.
Do you have another practice where you think?
This is what
should be more or less.
So this is what we say. Every new partner, every time you have unprotected sex, you need to be getting tested. Okay. So every time, ideally, new partner, new unprotected sex, you need to be getting tested. Ideally, if that doesn't work, we say about every 3 to 6 months, But I always say even if you're in a long monogamous relationship, you should still be getting tested every year. You need to make that a part of your normal physical health routine because you never know. We always want to make sure.
Even when I was in a relationship, I was getting tested every 6 months because with women, I believe they're not just testing for STDs when you go in for this checkup. They're doing cancer cell screening and stuff like that.
It all kind of depends. You have to have a conversation with your healthcare provider about what you want to be getting tested for. Okay. So sometimes they may be doing a PAP to look to see if the cells in your cervix are changing, and that can lead to other things. But again, most of the time, if you want to be tested for STDs, you need to tell your doctor, and you need to tell them what types of STDs you want to be tested for.
Okay.
Yeah.
Awesome. So, what is prevalent today? I mean, what kind of things are we up against with?
So
we're
up against a lot of things, and that's really scary. The STDs that we see are definitely at an epidemic level, and the rates are not slowing down. And so that's really scary to us because a lot of our STDs are asymptomatic, which means they have no signs or symptoms. So unless you're getting tested, you're not knowing you have an STD or not. And that's where we see them spreading very often.
Would you say that there are certain counties in Iowa? Would you say there's a link between sex ed? With the counties in Iowa, would you say there's a link between a sex ed curriculum and them having a higher STD rate? Or is it just kind of population-based?
I think a lot of it's population-based. I would love to say that it's because they're getting great education. They're not, that's just not true.
Some people just don't want to get tested, I guess. I'm kind of like I said, I went and got tested when I was in a relationship even because I would want to know right away, start treatment as soon as possible, whatever you can do.
Right, and it's just, it's 2020, we're still really at a level of stigma with STDs. Nobody wants to get tested, nobody wants to talk about it, but we really need to encourage people just to make it a part of their routine health screening. You go to the doctor for so many other things. Go to the doctor and get tested for STDs. Yeah, your healthcare provider. Just make it a part of your common health routine.
That is scary. You hear about epidemics on the news every day and people taking precautions against the flu, the coronavirus, and then here you have it. You're sitting here telling us what an epidemic this is, and how many of them can lead to death.
Oh, quite a few. So we look at our syphilis, we look at HIV, we look at hepatitis C. Those are all, if we're not getting tested and treated appropriately, those can lead to death.
So syphilis, what? I don't even know what that is.
Yeah, so syphilis is an STD that we get through any type of sex we have, whether it's vaginal, anal, or oral. We can get it that way. Come in contact with their vaginal fluid or semen.
So it's just the fluid?
No, because with also syphilis, there's sores. There's a syphilis sore. So if you come in contact with genital rubbing with a syphilis sore, that's how we can see you get syphilis as well. Scary thing about syphilis.
I don't even want to go to a strip club anymore.
No.
I'm done.
I didn't think you as the type of person that went there anyway.
I'm not. But The rub.
Remind me not to grab any of his dollar bills.
But the thing is, what's scary is syphilis used to be an STD we would see about 10 to 20 cases of. And then in 2013, we saw over 100. And in 2019, our staff investigated around 232 cases of syphilis.
So with syphilis then, I guess you're saying like even if you used a condom, you could still get syphilis.
Yeah, if there's genital rubbing. So if you use syphilis, genital herpes, genital warts, if there's still a condom and you have genital rubbing, yeah, you can still get the STD because we know condoms are not 100% effective.
So what would you say? I mean, of course, like we said, abstinence is one thing, but I mean, aside from that, I mean, just making sure your partner's getting
Make sure you're having an open and honest conversation with your partners. You know, that's the dating scene has really changed how we talk to our partners. Think about what online dating has done.
I'm blaming Tinder.
Yeah, no. I can't blame Tinder because I met my dating sites because I met my husband on Bumble. So that's something really. Yeah.
Congratulations.
Thank you.
That's awesome.
Love found online.
Yes, love found online.
I've been tempted. ChristianMingle.com.
Yeah.
I've been really tempted. I have my coworkers trying to talk to me about joining ChristianMingle.com to find a nice guy because she just met somebody and got married off of there.
Yeah.
But
I guess it's how your approach is.
It
when
is.
when you meet these people. If you real quick, hey, I just met this person online today, and then run over there and
it
get after it.
And it's made the hookup culture a lot easier. You can just get on your phone from the comfort of your couch and be like, "Whoops, swipe right. This person wants to hook up."
Right.
And from what I heard, Tinder is usually just for hooking up. Like even if the person says they're just looking for friends, that means hookup. I've never used Tinder, so
it used to. I don't know. I know that they all change what their game is. Game is. But so that's kind of changed the online culture, the dating culture a little bit. But I mean, yeah, it's definitely changed. So I think it's having an open, honest conversation with your partner about it getting tested.
What would that conversation kind of look like if you just meet somebody off of Tinder and you guys went to dinner, now you're about to go back to his house and you're watching Netflix or whatever.
You're Netflix and chilling, yeah.
Netflix and chill, yeah. You guys are, making out, things are getting more passionate, and then you're like, hey, do you have any STDs?
Do you have a condom?
Do you have a condom?
Do you have a condom?
Yes.
I mean, if you don't feel comfortable having the STD test, which I get it, like right away off the first date, hey, do you have a condom? No, they don't have a condom. Okay, well, I don't feel comfortable having sex with you.
I was taught a long time ago, and I don't care how this makes me sound, I was taught a long time ago to carry condoms with me.
Absolutely. It shouldn't just be the guy.
My mom always told me that. My mom always said, you never know when you're going to be in, like, a situation and you feel like doing that. My mom taught me, sexual freedom. You know, you don't have things happen. You're not horrible for it.
No.
So be prepared. It's better to be prepared than to deny that you will ever be in that situation.
Absolutely.
Because you want to look like better or something, you know? We all get in those situations sometimes as an adult.
Right. And so I think both men and women should always have condoms with them. I think also you need to talk about oral sex. A lot of people think, I can't get an STD from oral sex. Well, that's not true. We see a lot of STDs in our throat. So if you're performing oral sex on a male, have them wear a condom. If you're performing oral sex on a female, use a dental dam.
Never seen one.
I've never seen a dental dam either.
It is like a thin piece of a condom. It's like a tissue, and they're flavored, and so it prevents a barrier.
Do you teach people how to use those too?
I absolutely do.
Okay.
Yep.
I might need to come take a class. I mean,
yeah.
I'm more worried about what's on somebody's mouth.
Absolutely. No, it's just really important for everyone to know the different options out there to protect yourself.
Okay, I do kind of have a question that's not linked to STDs. It's another question. I was wondering if in your curriculum you ever talk to people about the emotional consequences of sex.
Oh yeah.
If you get into that too.
We do talk about the emotional consequences of sex. We talk a little bit about, kind of how you're feeling. So sometimes how you feel after, how you feel during, and how those feelings are normal. And how those feelings may trigger other things. So I think it's important to talk about the emotional consequences of sex.
Absolutely.
Because we might think, okay, well, I just had sex with this person. Now that means they love me. Well, sex means different things for different people. And
It
so
does.
I think it's important for everyone to know that it may mean...
And that's another thing people should communicate up front, I think.
Mm-hmm.
Like, what their expectations are as far as what does sex mean to you.
Yeah.
Like, when you're on a date or when you first meet somebody and you're feeling a sexual attraction to them, it's a good time to kind of bring up what does sex mean to you.
Sometimes sex means just sex. Sometimes sex means love. Sometimes sex means a long-lasting relationship. So I think it's really important to have those open conversations as well with your partner or whoever you're hooking up with.
Yeah. So it could be something like, I only have sex with people I'm in a relationship with, so then you're kind of setting that expectation.
Yeah. Mm-hmm. Yep. It's all just, I think the most important thing about like intimacy is you just have open and honest conversations. So everybody's knows what's expected out of each other.
Gotcha. So if you guys are just now tuning in, then we'd love to again introduce Nola from Polk County Health. We have the pleasure of having her sit with us today, and they're also one of our sponsors for the Conscious Kickback, which is our event at Vaudeville Muse on March 13th. Be sure to come check that out. A lot of great talent, and we're really excited for all the sponsors that we have. We also have Fong's Pizza. They're one of our sponsors.
They're delicious, yes.
Everyone loves Fong's. That's around.
I'm always trying to sneak over there when I'm bartending. I'm always trying to go over there and get some pizza. It's so good.
So good.
We'd also like to shout out to our sponsors, the Brothers Entrepreneur is a social group here in Des Moines. We have Court Avenue Restaurant and Brewing, another amazing restaurant down in the Court Avenue district. They've got a ton of great food. Have you guys been there?
Yes, been there several times. Good food.
Amazing.
Awesome. We have our after party. Our official after party will be at Copper Cup, which is right across the street from the venue, Vaudeville Muse. So be sure to pick up your drink ticket at the kickback and then shoot over.
Oh, nice. What's the drink ticket?
I'm
just hearing about.
Oh, so you get they're going to do drink tickets, so we'll give out drink tickets. There's a ton of prizes also you can win at the Conscious Kickback. So I know that we are giving away a 40-inch Samsung TV.
Oh, awesome.
There's a ton of other prizes that will be given away. Make sure that you go online to our event page on Facebook and look up the Conscious Kickback. Our sponsors are kind enough to supply us with a lot of awesome prizes for people that are buying pre-sale tickets. So every week we'll be giving away some kind of prize. So this week it's if you share, tag a friend, and like the post, then on Friday we'll be giving away free lunch at Court Avenue Restaurant Brewing Company. So be sure to take advantage of that.
Very cool.
And that prize will be given away on Friday. I think next week they were talking about doing a buy your pre-sale ticket and you'll be entered to win something. So let's just be sure
It'll be on the Conscious
just check out
later.
Right, definitely just
when his
tune
memory
in for
returns.
that. Shout out to Good Vibes Yoga as well. All the
yes,
positive things that they're doing there. Image 360 does all of our amazing graphics and print. So shout out to them. Make sure you connect with them. And last but not least is Inner Space down on Kia Way in Des Moines. A lot of awesome holistic health things going on
They
down there.
have a Himalayan salt room.
They do.
Very
That's
cool.
awesome.
Yeah, and
Very cool.
Oh my gosh, there's so many health benefits to Himalayan salt, so I need to try that.
Yeah,
Very
you
cool.
breathe it and it cleans out all this.
Don't they do like Reiki and stuff in the salt room?
I believe
On those
so.
massage,
Yeah.
like on a massage
Very
table?
cool.
They had a couples thing for Valentine's Day I saw, but yeah, it looks awesome.
Very
I'm
cool.
gonna have to check that out.
So yeah, again, special thanks to them. You guys can go on eventbrite.com, look up Conscious Kickback, and get your pre-sale tickets today.
Very cool.
You guys gonna be there?
Yes.
Awesome. Cool. So what else do we need to know about being safe?
I just think, again, the smartest thing is getting tested. You need to be getting tested if you're sexually active.
Okay,
Yes.
so do you have statistics as far as like Des Moines or Polk County, for example, even here? What
Yeah.
would you say?
So
is-
let me tell you, I can tell you right
Okay.
now what we saw last year.
And I mean, if you're
Get my
listening from
notes.
another city, Des Moines is not a huge city, so imagine, these numbers multiplied for larger cities and how fast they could multiply. I don't know if anybody watches like Pandemic on Netflix or anything, but I think this kind of works the same way, and I'm surprised that this isn't a serious conversation every day.
So our staff investigated for chlamydia 3,849 cases, gonorrhea 1,351, syphilis 232, and HIV 37 cases. Okay, so that's of the people who are getting tested. Now I think that number's probably 2 to 3 times higher in the Des Moines area, Polk County area.
So where are these things coming from?
So it's just a lot of people. I mean, it's people having sex with other people, and they're not being safe about it.
So like 37 people, can we just this is horrible to say, but can you obviously, I'm sure there is a form of quarantining these people. Like, you're not supposed to continue to engage in sexual acts if you have a disease like that.
So
not
to tell people if you are infected.
So if you willingly, the only one that you can post legal charges is HIV. So you have to willingly know you have HIV before you have sex with someone. So there could be some times where you haven't gotten tested and you don't know you have HIV and you have sex with someone. So that's not technically a crime. You have to willingly know you had HIV.
Okay.
Right. I know that Usher got sued a while back. Some lady sued him for supposedly giving her some kind of STD.
So the rest of them are not really legal. And it's up to you to share that with your partner or not. One of the things that we do at Polk County Health Department is we do, our staff, we have 4 public health investigators on staff. And so what they do is anywhere in Polk County someone tests positive, so whether it's at our clinic, it's at a hospital, it's another, let's say Planned Parenthood, primary health care, we get those results. So the hospital or lab will report those results to us, and then our staff will follow up. So we'll contact that individual, make sure they got tested appropriately, tested and treated appropriately, and then we're going to ask them for a list of their partners. They're going to give us their partners' names to the best of their ability, and then we're going to contact those partners. We can never tell the partners who gave them that STD.
Okay. Right.
We're just making sure that the partners are getting tested and treated appropriately.
Are there any cases where that's happened, like actual court cases where that has went to court?
There are actual court cases that have went to court.
I figured that's how the law kind of came about, but...
Yes, with HIV. Yep. Yeah.
All right.
So, which out of all of the STDs that you just listed and everything, how many of them are treatable?
So, gonorrhea, chlamydia, and syphilis are all treated by antibiotics.
Okay.
Yep. Hepatitis C is treatable by medicine. This medicine is incredibly expensive, the regimen. HIV medication has come such a long way. I mean, remember when we first heard what HIV was, it was a death sentence.
Right.
People are living whole, healthy lives. They're dying of old age with HIV.
All people are just like...
Magic Johnson.
All people are very, very rich celebrities.
All people. The medicine is amazing now. So if you live healthy lifestyle and you're taking your medication every day, you can die of old age and have HIV.
Wow.
Mm-hmm. There's also a medication out there called PrEP. And this is for individuals who might be at high risk for coming in contact with HIV. They take PrEP every single day. It's about 97 to 99% effective. They will not get HIV.
Wait, so it's like a preventative medication?
Yes, it is a preventive medication.
So how would you decide if somebody's
at high risk? Absolutely. So we typically, it'd be maybe a man who has sex with a man, because that's a high risk for HIV, definitely with anal sex. A person who's using needles for drugs, a person who's not having monogamous sex, so multiple partners, not being safe. Maybe their partner's HIV positive. Yeah.
Oh, okay. So if you have an HIV positive and you take this medication, it like creates antibodies.
Yeah. So it creates protection for you to hopefully 97 to 99% effective. That you will not get HIV.
It's amazing.
It's amazing. Yeah.
Wow. So we've come a long way from the 80s and early 90s.
Yeah, and so hopefully in the next couple of years, we'll hopefully this is wood, we'll find a diagnosis and a cure for HIV.
Wow.
Yeah.
Gotcha. Yeah, that's amazing. I didn't even know that.
Yeah.
But I just thought that Magic Johnson was just a weird case. Now you're saying that everyone has access to that.
Everyone has access to that.
Is it expensive though? I mean, I know.
So most insurance will cover it. If people are not insured, that's the Ryan White Act. And the Ryan White Act was created. Ryan White was a young boy who was a hemophiliac who needed blood transfusions. And he got HIV from one of those blood transfusions. And so that was how the Ryan White Act was created. So anyone who cannot afford medication to get treated for HIV, they qualify for the Ryan White Act.
Wow. Okay.
Yeah.
You learn something every day.
Yeah. The more you know.
Right. That's what we're about here, spreading awareness. So
that's fantastic.
Yeah, that's been awesome finding out some of this stuff. So what else do we know?
What else do you want to know?
What else you got down there, Cindy? She's been a great guest. We've learned a lot of stuff.
Absolutely.
Yeah, this is very. I feel like I'm learning a lot. Okay,
we don't want to let
kind
you
of
go
looking
yet.
over at your notes. Okay, so you do have something with the signs of symptoms of STDs. Maybe we can kind of cover that, because it sounds like we really need to encourage people to get tested, even if they feel embarrassed.
Absolutely.
It should become part of your health routine, like physicals, everything like that.
You go to the doctor for the flu.
No matter what, I will go get tested every 6 months.
Because you might not always feel something or hurt
like
or
she said,
see
there's
something.
not even symptoms to some of them.
So the majority, there are symptoms for every STD.
Oh, okay.
But the majority of people who have STDs do not have signs or symptoms. So you might not even know you have an STD or not.
You know, I do have a question.
Absolutely.
You know how they, what was the deal with the vaccine that they created for HPV?
Yeah.
Like, how has that went? I kind of lost track of it.
Yeah.
I know that they offered my son to get that shot.
Yeah.
My son is a 15-year-old. They offered him at the doctor's office to get that shot. And I was just kind of like, oh, this is like a thing now.
Yeah.
You know, so I'm kind of wondering.
It's definitely a thing.
I heard some really bad things about that vaccine, so if you have any myth busting
here. The myth
Would
busting is there really are not, we have not seen any real side effects with this STD. With this, vaccine. No, with STDs there are side effects, yes, but with the vaccine, no, we have not seen any significant side effects. I mean, some of the side effects of getting a vaccine is that spot where you get the vaccine, it might be a little red, it might be sore, it might be a little warm. That's because it's like a foreign object going into your body. Think of it like, I always think of like a bug bite. Think of a bug bite or a bee sting when you get a vaccine. Your body is building some response to it. And that's why it might be a little red when you get the shot. So the HPV vaccine, the Gardasil vaccine, is great because it protects against our kiddos against the most common strains of HPV that cause cancer. So the most common strains of HPV are in that vaccine. So we can start giving it to our little ones as young as 11 and 12. And they can go up to, new guidelines just stated that it can go up to the age of like 45.
Wow.
Yeah.
So, you know, there's always conflicting things when it comes to vaccines and different things. So make sure you always do your own research to come to your own conclusion on that.
Or, you know,
but the one thing I also
right?
wanted to mention is that you've got HPV is probably the most prevalent STD of all, right?
HPV?
Yeah, human papillomavirus.
That's why I was wondering if the numbers had decreased or...
So what we see, about 90% of people who've had unprotected sex have some form of HPV. So if you've had unprotected sex in your lifetime, 90% of the population has HPV. Now it's going to do a couple of things. It can go away. It can stay in your body and do nothing. High-risk strains can cause cancer. Low-risk strains can cause genital warts.
So we've started these vaccines, and it's still becoming even more and more prevalent now that we've introduced these vaccines, which seems kind of troublesome. You know, that it must really be becoming very prevalent,
right? And
with the vaccines being introduced.
So maybe what's happening is like those strains are kind of dying out because of the vaccine, but there's still other strains.
So when we look at HPV, there's over 150 strains. And in and in the vaccine there's only 13. So we can only put as many strains in a vaccine.
Kind of like the flu shot.
We put the most common strains that we see in that shot vaccine.
So HPV, what kind of things can you expect from that since it's so prevalent? Going untreated. I know that men don't have any knowledge
Yeah.
whatsoever.
Do men not have symptoms? Well, they do, but it's internal.
some of the symptoms might be, if you're low risk, you might get genital warts.
Okay.
Okay, so some of the symptoms with low risk HPV are genital warts. Some of the symptoms that's both for men and women. High risk can be different forms of cancer. So in men, we can see mouth and throat cancer, anal cancer, penile cancer. In women, mouth and throat, cervical, vaginal, or anal cancer. Cervical cancer, we've linked HPV to pretty much all cervical cancer cases.
Wow.
Yeah.
So it is like,
it
is what's causing cervical cancer.
It's definitely very scary. Yeah, so that's why.
So that's one way to prevent a cancer is to, avoid unprotected sex.
Absolutely.
To get tested when you are in a monogamous relationship and choose to have unprotected sex.
And get that vaccine.
There's one cancer prevented right there, since cancer is such a thing right now.
Absolutely.
But you're saying 90% of people already have a strain.
Yeah, I mean 90.
That's like laying dormant.
Yeah, if you've had unprotected sex in your lifetime, we see 90% of the population have it.
How come, like, if I go to get an STD test, that's like, it doesn't, I don't think it comes up on people's tests. I never had.
So HPV is such a new kind of STD that the CDC, Centers for Disease Control and Prevention, they're trying to figure out new testing methods to be able to test for it. I know there is one, I think there's one type of test in progress where it's like a mouth swab. So they'd be able to swab in your mouth to see if there's an HPV present.
Okay. Interesting.
Yeah.
All right. Well, we're back at it again. So, yeah, I mean, the HPV is, I mean, at this point, it's just kind of something that you would just, I guess, don't continue to contract more if you have something like that.
You just want people to be smart about it. Just make sure, I guess, the really best preventative method, which HPV is, to make sure you're using condoms.
So I feel like this is a really stupid question, I know, but if you're saying you can get it from throat and everything, is it transferred through kissing, or is it just like
you have to come in contact
bodily fluid?
Yep, you have to come in contact with someone's vaginal fluid or semen to get an STD. Absolutely.
No toilet seats.
No toilet seats. Can't get an STD from a toilet seat. Kissing, sharing a glass, hugging, no.
Nothing from a kiss? Not even like a herpes or something?
A cold sore you could, but not necessarily a genital herpes.
Okay. Gotcha.
Yeah.
All right. Well, we appreciate you coming on.
Thank you so much. Thank you very much.
Thank you.
Appreciate it.
No,
I feel like I learned so much, and I already thought I knew everything, which is usually me.
It's my job. I try to help.
Right. And so, if someone wants to get tested, one more thing for them: if they want to get tested, if they need condoms, anything like that.
Condoms, you can come to Polk County Health Department. If you want to get tested, come or call us.
Okay.
We're located at 1907 Carpenter Avenue here in Des Moines. We're on a bus route 286-3798.
Awesome.
Okay, and then is this private free testing?
So everything's private and confidential, and we're low cost.
Low cost. Okay.
Yeah.
So if somebody doesn't have insurance, or
they don't have the financial means. Yes, we will test you still, regardless.
Okay. Yeah. Perfect. Well, guys, make sure you do go out and get tested. Do your research. Practice safe sex, and everyone have a great day and be safe.
Thank you.